RTF was, originally founded to fund things like that supported resident education, materials, and equipment. In the words intrinsic to the fund, Patient Care Trust Fund, it seemed like it was a natural progression to be able to apply for things like quality improvement projects or conferences that enhance resident education about particular issues around patient safety and other things. That just be something that this fund should be able to do. Residents have applied for and have been granted funds for opportunities like to be able to attend conferences, the Telluride conferences.
Learning about patient safety in the mountains. God, I love this place. Effective communication skills.
I met Justin Wood, who is a great resource, and he told me about the opportunity to come to a patient safety summit that was happening in Telluride, Colorado. So I became interested and I applied to the Patient Care Trust Fund.
Being here and speaking to everybody, meeting everybody, I saw that change is possible. Here, I met people that are really pushing things forward in patient safety, and things that I thought were actually impossible in my own facility, I'm seeing they actually are possible.
So my project focuses on looking at this log and identify the possible causes of these errors.
So the Patient Care Trust Fund traditionally wasn't used for something like this, but what I did with the help of Justin was put together an application requesting funding not only to attend the conference, but to put together a quality improvement and patient safety project at Bellevue Hospital.
Recently there was an application that came in for supplemental funds to support a research fair. So that was supplied through the Patient Care Trust Fund.
And we've never had a research fair before, so we thought it would be great if our hospital had a general research fair for all specialties.
Patient comes in with chest pain, you get an EKG, shows ST elevation, anterior leads. What do you think? Are you sure?
Me personally? No, I'm not sure.
Okay. Well, most people would think it's a heart attack, and it usually is. But you got to think about other things that can cause this.
The medication patient safety conference that was held in Jacoby was in part funded by the Patient Care Trust Fund, and actually they continue to work with the Patient Care Trust Fund in order to do the grand rounds at the different hospitals that the project was slated to do.
And I think the overriding problem that we all have is a lack of respect for the power of medications on the part of both physicians and patients.
And we want, first of all, for the patients not to suffer needlessly. But by making them very comfortable, we also don't want them, want to put them in another conundrum about having an abuse potential. So it's like between a rock and a hard place, I think, sometimes with pain management.
The great thing about that conference was, in particular to that conference, was that you had a multitude of departments and specialties that were represented there, all united in a common theme and a common goal.
This would do one for antibiotics, and that would help the residents, the nurses, and the attendings to know that there is a formulary which we all stick to. And this would help streamlining between the ER and medicine, between the ER and surgery, between surgery and medicine, so we're all using the same drugs.
So I just want to say thank you to the people at the Patient Care Trust Fund who enabled me to come here. I'm eternally grateful, and I look forward to starting some interesting projects and helping the patients at Bellevue in a very profound way.
I think this was a huge cause, and if we could learn to utilize it in more creative ways, I'm excited to be part of that. So.
I just want to say a big thanks to CIR for sponsoring me to come to this workshop. It has made a big influence on my career, and I know it will from here on out, and this was an opportunity that was a once-in-a-lifetime thing for me, and I just want to say that I'm so appreciative that they would have taken a chance on having me come to this conference.
So go out and change the world. Thank you.